From the JAMA Network, this is JAMA Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinion featured in JAMA.
Hello, and welcome to our listeners from around the world. This is a JAMA Author Interview podcast. I'm Dr. Tracy Lieu, Deputy Editor at JAMA, and today I'm very pleased to welcome Dr. Chi-Fu Jeffrey Yang, author of a new research letter in JAMA titled Preventive Healthcare Use Among Adults Eligible for Lung Cancer Screening in the United States. Dr. Yang is a thoracic surgeon at Massachusetts General Hospital and an associate professor of surgery at Harvard Medical School. Welcome, Dr. Yang.
Thank you so much for having me.
Let's start with a background on lung cancer screening. For which patients is it recommended, and why is this an area of opportunity for improvement?
Lung cancer screening is currently recommended for patients between the ages of 50 and 80 who have smoked more than 20 pack years and are either currently smoking or have stopped smoking within the past 15 years. And there's definitely a lot of room for improvement because right now lung cancer screening rates are extremely low. In fact, based on the most recent estimates, fewer than 20% of individuals eligible for screening actually get screened. And that's really sad because lung cancer screening has been shown to significantly reduce lung cancer mortality by at least 20 to 33% in two large-scale randomized trials and could potentially save tens of thousands of lives each year in the US if we can get that lung cancer screening rate much higher.
Yes, so these low rates have been known for a while. What led you to do this particular study at this time?
So in terms of things that we've been exploring, the reasons why lung cancer screening rates are thought to be so low, it's a complex topic. But a lot of people anecdotally have this notion or even bias that individuals eligible for lung cancer screening may be hard to reach and less receptive to participating in preventive healthcare like cancer screening. And I think this is because lung cancer screening is currently recommended for individuals with a history of smoking, and there's a lot of stigma associated with smoking. We know that smoking is more common among individuals with lower socioeconomic status and individuals with mental health conditions. And I think there's a belief among many in our field that, well, individuals who are eligible to get screened, they're just hard to reach. And some may even say, tough luck, that's a big reason why lung cancer screening rates are so low. But all these beliefs and notions I've mentioned here, there's no empirical data to back this up. And I think this is all related to stigma and bias. So we wanted to ask a very simple question for this study, which is, are individuals who are eligible for lung cancer screening truly resistant to receiving preventive healthcare, or is there something else going on?
You were able to use an important national data source for this study. Tell us about the data source and the design that you used.
Yes, so this data source we used was the 2022 Behavioral Risk Factors Surveillance System. And this is a national telephone survey of approximately 450,000 adults in the US. And because this is a national survey, it allowed us to obtain national estimates of the use of cancer screening tests for our study.
And tell us what you found.
We first looked at all individuals eligible for lung cancer screening and breast cancer screening, which is around 5 million people based on weighted estimates. And we found that 65% underwent breast cancer screening. In contrast, only 17% underwent lung cancer screening. We then looked at all individuals eligible for lung cancer screening and colorectal cancer screening, and that's a little over 11 million people in the US. And we found here that 65% underwent colorectal cancer screening, and similarly, only 18% underwent lung cancer screening. So use of breast and colorectal cancer screening was nearly fourfold higher than use of lung cancer screening. And we also found that breast and colorectal cancer screening use was slightly lower among people eligible for lung cancer screening compared with people who are not eligible for lung cancer screening.
Yeah, so it sounds like your findings are implying that these patients actually do participate in other types of cancer screening, although perhaps at slightly lower rates than patients who are not eligible for lung cancer screening.
That's correct. This study hopefully gives good news, which is that the abysmally low lung cancer screening rates we're seeing nationally is probably not due to people being resistant to getting cancer screening.
Yeah. So, what are some of the other potential barriers to lung cancer screening that these patients may be experiencing?
I think our data suggests that low lung cancer screening rates are driven largely by system level barriers, including difficulties assessing lung cancer screening eligibility and challenges accessing lung cancer screening clinics. Our findings emphasize the need for interventions to increase awareness about lung cancer screening and reduce the barriers that prevent high risk individuals from accessing screening.
What types of future studies do you think that these findings imply are needed?
I think a key focus should be on increasing lung cancer screening awareness. And this is an area I'm very passionate about. I currently work with the American Lung Cancer Screening Initiative to increase lung cancer screening awareness through community outreach across the US. And we also need to focus on research to develop and implement interventions to reduce barriers to lung cancer screening access. There are many notable system level barriers that make it challenging for high risk individuals to get screened. For example, difficulties assessing lung cancer screening eligibility due to the use of age and multiple smoking history requirements is a challenge in primary care settings. And efforts to improve the identification of individuals eligible for screening are needed. For example, if we can simplify the criteria to use smoking duration rather than pack years as a criterion, sometimes referred to as the Potter criteria, this could be helpful. And additionally, in a recent JAMA Network Open study, researchers called over 1,000 US hospitals and found that only 9.7% of hospitals could connect them to any component of the lung cancer screening process. So, as a community, we really need to work harder to reduce these barriers together.
Wow. Well, your study has a lot of messages for policymakers and for systems. Do you have any key take home messages for the practicing clinicians among our JAMA listeners?
Thank you. This study hopefully gives good news for practicing clinicians, which is that low lung cancer screening rates is probably not because people don't want to get screened for lung cancer. Our findings support that many people eligible for lung cancer screening are accessible to outreach and they're receptive to receiving preventive healthcare services. For example, many of the people in our study were receptive to getting mammograms and colonoscopies. So I think the key take home message for practicing clinicians is that please, if you know somebody who is eligible to get screened, talk to them about lung cancer screening. They're not going to fight you or be resistant or reluctant, as our study has shown. Many of them are getting screenings that are much more complicated, I would say, than lung cancer screening, which is really just a 2-minute test. You lie on the scanner, you get screened, you come in with your street clothes, you lie on the scanner with your street clothes. It's covered by health insurance, it doesn't hurt. And so, to just please, if you have patients who are eligible, to ask them about their smoking history and get them screened.
Well, thank you, Dr. Yang, for the overview of this important and really broad reaching study.
Thank you very much again for having me. Appreciate it.
I'm Dr. Tracy Lieu, and I've been speaking with Dr. Chi-Fu Jeffrey Yang about his research letter in JAMA titled Preventive Healthcare Use Among Adults Eligible for Lung Cancer Screening in the United States. You can find a link to the article in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Morrow at the JAMA Network. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.